Thank you, Mr. President. I rise in the strongest of opposition to this bill. In my community of Rochester, we have been having a painful conversation over the last several weeks about who belongs and how we treat our neighbors. So I want to be clear to our undocumented neighbors that you belong. You deserve health care. Health care is a human right, and everyone should have access to the care that they need. This is not what we should be doing. And I want people to know that there are members in this body and in this Capitol who will continue to fight so everyone has the health care that they deserve, in this Capitol and outside of this Capitol. There is no good reason to pass this bill. It is cruel, it is harmful, and I think we should be very clear that it will affect people, moms, dads, brothers, aunts, uncles, grandparents, loved ones, members of our community, neighbors, workers, people who matter, people who deserve care, upwards of 15,000 people. People like Juana, who lives in Rochester, a middle-aged working woman with no spouse and grown kids, who said, when I was approved for Minnesota Care, she said, I've been wanting this more than a work permit. People like Jonathan, who lives in Mankato, who's a construction worker, who suffered a severe visual impairment due to an accident when he was a child, which resulted in the loss of his left eye. And because of the eye injury, he needs special prescription glasses that need to be checked every 6 months. The first time he went to the doctor, the cost was over $1,000, and he had relied on borrowing money from a neighbor to help him get some glasses. And he said now with Minnesota Care, he could finally take care of that eye injury. He could get the care that he needed so he could take care of his eye. These are the people that, with the push of our button from members in this chamber, we all have access to health care. We all have health care coverage. Our families have coverage. With the push of a button, we are going to take that care away from 15,000 Minnesotans for no good reason. This bill is not going to save us money. I agree with the author of this bill with one of the things that he said, that we should be honest about what's happening here. We should be. This bill is not going to save us money. This bill is going to cost the state money. As a nurse who takes care of patients in a hospital, I can tell you that it is more expensive when people do not have health care coverage. They put off care until it becomes an emergency, and then they are seen in the emergency room where care is far more expensive. Everyone is better off when people have access to health care coverage. Hospitals and clinics, which is why they supported this measure when we passed it previously, and they opposed taking it away. And all community members, we are all better off when people have access to coverage. My son was hospitalized last week. Started with a clinic visit, then some testing. He was seen in the emergency room, more testing, overnight in the hospital, more testing, and then clinic visits. At no point during all of that did I have to consider, gosh, should I do what the doctors are saying needs to be done? I didn't have to consider, should I do that or not? Can I do that or not? Because I have health care coverage, he has health care coverage, but that's going to be the reality for thousands of Minnesotans after this. This is not what we should be doing, members. Our job here is to make people's lives better, to help people, to improve people's lives. This is not what we should be doing. It is going to harm people, and we should be very clear about that. Vote no.